Lord's Passover. For he passed over the houses of the people of Israel in Egypt when he struck the Egyptians, but he spared our houses. And the people bowed their heads and worshiped. I cite this scripture because it's kind of reminiscent and reflective of what it is we're going through today. At this time, the people of Israel were preparing for a great exodus from captivity, a great exodus from the land of Egypt where they were held captive. But there were a whole set of instructions that had to be followed. And this 10th plague that God said he was going to allow to occur in the land of Egypt, this 10th plague, the plague of death, which would destroy the firstborn of not only those in the palace, but those in the dungeon, the firstborn of livestock. This plague of death, which was going to be allowed to come over the land of Egypt, God is saying, but I'm going to spare my people. And I'm going to spare them this way. I need for you to listen to these instructions, follow these instructions, and you and your house will be spared. And the 12th chapter outlines a whole bunch of specific instructions. Secure an unblemished lamb, a paschal lamb, so to speak, an unblemished lamb, sacrifice that lamb, take a bunch of hyssop, dip the hyssop in the blood of the lamb, and put the blood around the doorpost. And when the destroyer comes, the angel of death comes, when the destroyer sees the blood-covered doorpost and lintel, the destroyer will pass over that house. But the instructions were very, very detailed. The lamb that was sacrificed had to be commensurate with the size of the clan, the size of the family. The doorpost had to be covered with blood. And the people had to stay in the house. Stay in the house. The message was clear. If you left the house, you were subject to be destroyed along with everybody else. Stay in the house. Use an unblemished lamb. Cook the meat. Don't boil it. Don't eat it raw. Cook it, then eat it. And eat it dressed. Be ready to leave. A whole set of instructions were given in order to save the people so that they might be released from captivity. And here today, as we are facing another plague of death called coronavirus, COVID-19, 275, 280, 290,000, approaching, if we have not already achieved it, 300,000 deaths. Some 3,000 people just died over the last 24 hours. As we are facing this plague of death, again, we have a set of instructions that we have been given to follow. And the set of instructions given to the people of Israel, they remind us today of the importance of not only the instructions, but more importantly, obedience to the instructions. For it is the obedience that brings about the salvation. It is the obedience that brings about the people's being saved and released from captivity. And today we have a set of instructions. Wear your mask. Keep physically distant. Wash your hands and do it frequently. Don't gather in large crowds, even medium-sized crowds. And don't be enclosed and in enclosed spaces for long periods of time, especially without a mask. Instructions designed to save our lives and to cause this pandemic to pass over us as best as possible. Many of us are challenged by following these instructions. We're challenged to follow them. The mask is irritating. We want to see our friends. We want to see our family. We want to go out. We want to go to dinner. We want to party. We want to socialize. It's difficult and challenging for many of us to follow the set of instructions that are designed to save our lives. And just as in this day, thousands of years ago, if you came out of the house, you were subject to the same destruction that was occurring in all of the land. It's true today. If you don't follow these instructions, if you are repeatedly out of the house and gathering in social groups for the purposes of socializing, unmasked, if you don't repeatedly and habitually wash your hands, you are subject to this pandemic. And we're thankful to God that to this point, those of us who are still here, and some of us have been infected. And just as was true then, it didn't say that there would not be those who didn't get sick, but it did say the angel of death would not be allowed to enter your house. And so this evening, we're going to be talking about COVID-19, the coronavirus. And we're so excited to have our guest expert to share in her knowledge about the coronavirus. She is a physician, board certified, and she works with the Overlook Medical System, and she is the medical director of the Union Campus of Overlook Medical Center. Her name is Dr. Stacy Murray, and she has agreed to be our guest this evening, and we're excited to have her with us. And if we could bring Dr. Murray now into our discussion, we want to begin by talking about some of the basics of COVID-19. And we're going to go into testing, when, how, where. We're going to go into the vaccine, as the vaccines are now on the horizon. And we believe it's going to be a blessing for you. So please stay tuned and pay attention, because these life study programs are designed to be of help to us in this day, in this time, in a very pragmatic way. They are designed to teach us how to apply Scripture to our lives in an everyday, practical way. So, Dr. Murray, can we have you brought to the screen at this time?
I'm not sure if you can see me, Pastor.
Yeah, now I can now. Yes, I can now.
Okay.
Yes, I can. Yes. And let me just say thank you so much for joining us. Thank you so much.
Thank you so much for having me. I think this is a perfect discussion at a more than appropriate time.
Well, good. So let's jump right into it, and let me ask you to begin by talking about the coronavirus. Maybe you could talk a bit about testing. How how do we get it? Where do we get it? When should we get it? Um,
Sure,
Proceed.
absolutely. So we've learned so much about this virus, and testing, which initially was not available, is now more available. And now, at first, a lot of people didn't consider testing because it wasn't even available. But now it's become readily available. So now we need to really take another look at when should we go and where should we go get tested. I advise most people to start with their primary care doctors. Believe it or not, there are some primary care doctors who are doing testing in their office. So if you have any concerns, start with your primary care doctor. They can advise you of where to go. There are always urgent cares that you can go to or an emergency department. Um, those may cost a little bit, but those are available as well. NewJersey.gov has a whole listing of free services and places where you can get tested for free. Some of them are mobile units, so they're going from town to town on different days. And they are testing any and everyone who wants to be tested. So testing is available if you want it or need it.
Okay.
But you start thinking about who really needs it and who wants it. As the medical professionals, we really separate people with coronavirus into, or people requesting testing for the coronavirus, into two separate groups. One is considered a symptomatic testing, meaning that you have symptoms, and the other is asymptomatic, meaning that you don't have symptoms. And some of the testing sites will ask, are you a symptomatic person or are you asymptomatic? Or you may see that on their website, that they only do symptomatic or asymptomatic testing. And what that means is purely if you have a sore throat, cough, anything that you might consider being coronavirus, that you can go to these sites and be tested. Asymptomatic testing is more for people who want to know if they have it, if they plan on traveling somewhere and they're planning to go see someone and want to make sure that they're negative before they get on a plane or train or go somewhere. Sometimes people coming home from school, you'll see a number of kids who are away at college or boarding schools will get tested before they come in. And those are all asymptomatic testing. The biggest asymptomatic tester that we see are people who have been exposed to someone else who has coronavirus, and they want to know, do they have it as well? And they're considered an asymptomatic person, and they can go to asymptomatic testing.
So, can you talk about smell and taste a little bit to explain how does this come into view with respect to the coronavirus?
So what we've noticed is that people who lose their sense of smell and sense of taste, they have a very high likelihood of testing positive for coronavirus. And this is without having a fever or a cough or any other symptom. So those people, oftentimes they may not think very much of it, that they're eating something and it doesn't taste the same, or they can't really taste it at all. Or we often hear people are like, I put on cologne and I don't smell anything. Loss of smell and taste is a very strong symptom for somebody who is positive for coronavirus. So any symptom, whether it be loss of smell and taste, fever, cough, sore throat, body aches, muscle aches, are all signs of coronavirus.
Okay, so let me remind our listening and viewing audience that we're talking to Dr. Stacy Merritt. She is the medical director of the Union campus of the Overlook Medical Center. and we're talking about COVID-19. And we want to hear from you. You can begin to line up in the chat room with your questions. We have someone there who will be taking them, and we will go to the questions once we finish laying the groundwork of our conversation and our information. All right. And as you know, we want to hear from you. We want to be able to respond to the questions that you have, and because we want us to be in a better place subsequent to this interview than we are prior to it. So, Dr. Mary, your any information you can give us about how long does the virus last or live on surfaces? What is my level of danger of infection by touching something that someone who has the virus or is infected has already touched?
Well, we know that the virus can live on doorknobs and glass surfaces for up to 5 days. But for the most part, our everyday activity, meaning opening your mail or opening packages, yes, the virus can live on packages for 3 to 5 days. But for the most part, that's not how the virus is spread. The virus is spread from close contact with people, although it can live on things for up to 5 days. So really, I think the safest thing to do is you can take your packages, bring them inside. There's no real concern about, I know initially when everything was very new, people were bringing in their groceries and wiping off every package. And we've really found that there's really no need to do that. If you bring in your packages, you put them away, you put away the containers that they came in, and you wipe down the surfaces that you laid the packages on with any type of disinfectant, bleach and water or Clorox disinfectants. That should be more than enough to kill the virus on the surface, and then follow that up with washing your hands.
Okay. And I just wonder how many of us are diligent about that. Just based upon my own behavior, going to the mailbox, receiving packages, picking up groceries and bringing them, back home into the house. I think I may have fallen short in some instances in terms of wiping down surfaces after the use of and the opening of these packages. So I just wonder. I'm not asking you to respond. I just wonder. And I'm being transparent about it. I need to be more diligent, I do think, in that area. But thankfully, God has covered us. So
I think we all have, because it's so easy to fall back into what's comfortable, and we're all so busy, and everyone comes in and they're being pulled in 10 different ways. So they put everything down, they put their groceries away as quickly as possible, and they're on to the next task. But we really have to be diligent about wiping down surfaces and washing our hands every time we come in from anywhere outside of the home.
Yeah, because oftentimes I have heard people say, this one got it, or this one got it, or I got it, or whoever, and they say, but I don't know how, I don't know where it came from, and
Yes.
and this may be one of those possibilities.
Absolutely.
So quarantine. Talk to us about quarantine.
Okay. Quarantining is so important. Everyone at the beginning of feeling any type of symptom, the first thing you should do is quarantine. And what quarantine means is really you shouldn't see anyone. You should be by yourself for a minimum of 10 days. So how I explain that to people is, if you've tested positive or you've been around someone who has been positive, you should quarantine. That means you should go into a room at home and close the door. You should be by yourself in that room, and you should remain that way. You shouldn't be eating dinner with your family, going to the kitchen, watching TV with your family. You really need to stay in one specific room with the door closed. In terms of using the bathroom, if you have more than one bathroom in your home, one should be for the person who's quarantining, the other should be for the rest of the family. If there's only one bathroom, then the person who's quarantining, when they finish using the bathroom, they should wipe everything down and disinfect it and bleach. Go back into the room and close the door. It means in terms of food that whomever you live with should cook and prepare your food for you. They should bring it outside the door, leave. You should then open the door, bring the food into the room where you're staying, and close the door. That's the safest way to keep everyone in your household, hopefully, from contacting this highly contagious virus. You should not be face to face with anyone. You shouldn't be watching TV with your family. You shouldn't be going to the kitchen and grabbing something to eat. Everything needs to be brought to you behind a closed door. You open the door after they are gone, so you're not face to face, close the door back, and you remain isolated and quarantined. That is true quarantining. And that's what we mean when we ask people to go home and quarantine. The only reason to break this quarantine should be to seek medical services. And this is why in the beginning, the CDC recommended that people have enough food in their house for 14 days. Because really, you should not be going out to the store. You shouldn't be going anywhere for that time is now decreased. It was 14 days originally, but now that's been shortened to 10 days. But you really should not be seeing anyone for 10 days. If you don't have the food in your house or something you need, maybe someone can deliver it. You can have, there are food delivery services, etc., that should be used. But one way that we're going to have to contain or do our part to contain the virus is really stay away from other people when you have symptoms.
We're talking to the medical director of the Union campus of the Overlook Medical Center, Dr. Stacy Mary. She is our guest, and we're talking about COVID-19. This is a life study of Morning Star Community Christian Center Church, and we're trying to make our lives better. We're trying to get a set of instructions, and we're trying to get a level of obedience that will bring about the necessary healing and safety from this pandemic. You may have some questions. We ask you to line up in the chat room and begin to surface your questions, as momentarily we will be taking as many questions as we can. Of course, we could do this all night, but we don't have all night. Some of us have to go to work. But we do want to hear your questions, and we do want to respond to as many of them as possible. So let's transition, Dr. Mary, to
Can I say one other thing about quarantining before we go on to the vaccine? Please. The other thing about quarantining is what's very important is that we ask people who have been around someone who's tested positive to quarantine. So what that means is if you went over your cousin's house on Sunday and you were there and just hanging out, watching TV, maybe took your mask off for a period of time, and then your cousin found out on Tuesday that they started not feeling well, and they were tested and they came back positive, you also have to quarantine for 10 days if you've been around anyone who's tested positive. So not only are we asking people to quarantine if you are positive, but if you've been in close contact with anyone who is positive, you also need to quarantine for 10 days. And I think we found that a lot of people don't quite understand that. It means that, and that really, the quarantine involves anybody that you've been around for 5 days prior to that person showing symptoms.
And are we not now, even as we speak, experiencing a compounded spike in numbers of hospitalizations, infections, and deaths as a result of not only the winter season being upon us, but the Thanksgiving holiday that recently occurred.
Absolutely. A lot of people want to be with family, which is understandable, but at this time, it's really hard to be with family because if you are not living in the house with that person, then you're exposing them to anyone that you've come in contact, and they're exposing you to anyone that they've come in contact. And that's how we're seeing such dramatic spread now. So we're very concerned going into the Christmas holiday and New Year's that we can have double or triple the amount of patients that we have now in the hospital because people are trying to spend time with family. But we just ask that really that's done virtually via Zoom. We really are asking people to only be with people who live in their household.
Yeah, good. Can't repeat that enough.
Yeah.
So it looks like on the horizon we have some vaccines, and we have several companies that have put forth candidates, and they have advanced their presentations to even, I think, third level schedule, whatever they have to go through to be approved. What are your thoughts generally on vaccines and their availability?
Oh, vaccines in general or the COVID vaccine?
Well, you raise a good question, but let me have you stick to the COVID vaccine.
Okay.
I don't want to get off because we could go in a direction that could take us a whole long time. But anyway, just the COVID-19. Any general thoughts about the COVID-19 vaccine? Really?
Yes. So the COVID-19 vaccine is new technology. And what is meant by that is typically viruses, typically vaccines take a small part of the virus, whether it's live or inactive virus, and that's what's used to make the vaccine. The COVID-19 virus does not use any live virus. The vaccine, let me restate that. The vaccine does not contain any virus. How this vaccine and the new technology was used is they found the gene code on part of the virus. They were able to replicate that man-made gene code and put that into a vaccine. And that is what gets injected. So it's a man-made genetic code that gets injected. Now this is like, whoa, man-made something you're injecting in me, but it's very safe in that it doesn't have any of the virus in it. So what it does is it introduces the body to the gene code of the virus, and the body recognizes it as abnormal and creates antigens to protect you. So if it were to see that again, meaning if you were exposed to coronavirus, your body is already able to fight it off because it's already seen that genetic code already. And that's the new creation.
And that's also some of the basics about how it works.
Right.
The vaccine, such as it is constructed, once injected into the human body, stimulates the healing mechanism inherent in the body to fight off and to destroy anything that looks like what was injected.
Absolutely.
Okay.
Without ever having been injected with any virus at all.
Got it. So what would be your recommendation to people as the vaccines come available?
Well, I understand a lot of people have a lot of concerns about it. And the concerns that I've heard are, how did this happen so quickly? Well, one thing that's different about the creation of this vaccine versus other vaccines is that Normally, it will take 3 to 4 years to have enough people enrolled in a trial to start to trial the medication. This happened with this new vaccine. They had enough volunteers in 3 months. They have almost 40,000 people enrolled in this study. And to collect 40,000 patients in a study of any other medication, like I said, typically takes years to do. So this is different. But I understand people have concerns, and I think it's going to be very personal. What's good for me may not be good for you. But I think that we have to look at each person's case individually. I think there are people who should not take the virus. And that group consists of anyone under the age of 18. The virus hasn't been tested on children. They're starting it, but it hasn't. So anyone under the age of 18 should not consider the virus at all. Also, anybody who's nursing, who intends to become pregnant, or who's currently pregnant should not take the virus. It hasn't been studied in pregnant women. So I think any children, anyone under 18, and any woman who's pregnant, considering being pregnant, or nursing should not take the virus, should not take the vaccine. On the flip side, in terms of who should take the virus or who should strongly consider taking the virus,
Vaccine.
anyone who is definitely in the medical field, who is around a lot of patients who depend on you or could be harmed if you infect them with the virus. So that includes anybody who's working in a nursing home. Also, anybody who is in retail, who's around a lot of people who have, anybody who has a high chance of getting the virus just because of the number of people that they're in contact with, should really consider taking the virus. And this includes anyone who's in public service as well. That if you are a Uber driver, a taxi driver, a bus driver, where you come in contact with a lot of people in close proximity in an enclosed space, you should really consider taking the virus.
So,
and even higher on top of this are people who are, I'm sorry to cut you off, but people who are at very high risk. And those people are, if you have high blood pressure, diabetes, kidney disease, or obesity, those 4 factors. And if you have 2 of them, if you have high blood pressure and diabetes, or you have obesity and diabetes, you really need to consider taking this vaccine.
Okay, thank you for that. So let's see if we have a question or two before, because I think we've gone far enough in our conversation to have stimulated some questions, some comments, some concerns. And so, Brother Fuller, are you there? And do we have a question, our first question for Dr. Murray?
Yes, yes, indeed, Pastor, we do. Doc, the first question is, once you're infected and have been quarantined for 14 days, how do you know you're not contagious or the virus has gone after your 14-day quarantine is up?
That's a great question. Some people will need longer than 14 days. If you still have symptoms, then you still need to remain quarantined. So if you still have severe weakness, if you still have a fever, then you need to remain quarantined until those symptoms are gone. You need to be without a fever for at least 3 days before you can really say that you're no longer infected.
Now, and this raises a concern that I have and that I've been hearing more and more in the media, that people who have been infected by the virus and perhaps even hospitalized, but are on the other side of that, it seems that, and I guess we're still finding out about this, that there's some long-term effects that don't seem to go away real quickly. Do you have any information or knowledge about research that's unfolding, what all this means in terms of long-term impact, long-term symptoms, or lingering effects of the COVID-19?
There are multiple people that we call long haulers who have symptoms for a very long time. And what we do know is that a lot of these people have uncontrolled diabetes. Their sugars are not able to be controlled, despite being on multiple medications and readjusting insulin and a number of other medications that it cannot be controlled. Also, the same with blood pressure. We found that is happening. We have people who have what they call a brain fog. They just don't, they're not as quick as they were before. They can't think through tasks and complete tasks the way they did before they had COVID. And that happens in a number of people that we're seeing this.
So, again, we're talking with Dr. Stacy Murray, the medical director of the Union campus of the Overlook Medical Center. And we're talking about COVID-19 and all of its implications and ramifications. We're also talking about vaccination for it. And if you have a question, you should be in our chat room having surfaced your question. And so let's go back to Brother Fuller to see if get our next question for Dr. Murray.
Okay, Doc, I got another one for you. If I already had COVID-19 and recovered, do I still need to take the vaccine?
So what we know about the vaccine and what we know about people who have recovered from the COVID-19 virus is that for the most part, most people have protection or immunity for 8 to 9 months. So I think anyone who has had COVID, who's recovered, they're really in a spot to really wait and see how long and really find some more answers in terms of, because we're still, investigating the drug, of how long the drug provides immunity, or the vaccine provides immunity for. That we don't know yet. We're thinking that it may be a long period of time, but we're not sure. And the only thing that will tell is time will tell. So I think that people who have had the virus can wait. They probably do not need to be in the first group of people receiving the vaccine. They have at least 8 to 9 months of protection.
As we have all been hearing, the Pfizer vaccine and there's another one that has come out early. What was that?
Moderna.
Right. They're like a two-dose vaccine, as opposed to some of the others like Oxford, AstraZeneca, and maybe Johnson & Johnson. They are, I believe, single-dose vaccines. Can you talk a little bit about the difference and maybe which? I don't want to put you on the spot, but it just seems to me taking one shot is better than taking two.
Well, I think the Pfizer and the Moderna vaccines, they are both have 95% or greater protection than the single vaccine, which is being found to be only about 70% effective. Mm-hmm. So it looks like the 2-shot is really going to be the best bet. And those typically are your first vaccine or the second vaccine is going to be 21 days after the first vaccine. So unlike some other vaccines where as a child you need boosters for, which may be in 3-6 months or even a couple years, it looks like the first vaccine followed by 21 days later having the second dose gives you 95% protection from the virus.
Now, as you know, historically, Black people and vaccines are usually hard to put in the same sentence, at least more difficult than other populations, and because of for historic reasons. Um, and even today, there are plans afoot to help convince people of color of the value and the safety of taking these vaccines as they become available. What to that, in the context of our history, what do you say?
I say what we know in terms of, I say that this virus is really destroying our community.
Hmm.
We are impacted so much more than others. And I think we are responsible for really saving our own community. So it's going to be up to us. We are going to be the ones who are going to have to distance ourselves, wash our hands, wear our masks, and take the vaccine to protect others within our community. Because the high blood pressure, the diabetes, the kidney disease, and the obesity are running rampant in our neighborhoods, putting us at high risk. So we know, what we do know about the vaccine is that if you've got any of those factors and you get the infection, the likelihood of having a bad outcome is very high. And pose that against to what we don't know about the vaccine. There may be some side effects that may come up later. The likelihood of having a side effect, a possible side effect, we have to, may be very small. I would think that it would be very small, the likelihood of having a significant side effect. So we know that if you get this and you have those factors, you're going to have not a good outcome, most likely. Because 71% of those of us in the African-American community know intimately somebody who has been affected by this disease, either hospitalized or who died from this disease. 71% of us can say, I know somebody who had a very, very bad outcome. So taking the possible risk of a vaccine that we know has the possibility to save a lot of lives is something that, we're going to have to deal with and have to make a decision individually if it's going to be good for you and for our community.
So we're talking with Dr. Stacy Merritt. She's our guest. She's the medical director of the Union campus of the Overlook Medical Center. And we're taking your questions. You should be in the chat room surfacing your questions should you have one. And let's go back to Brother Fuller to see if we can take the next question for Dr. Merritt.
Yes, Doc, got another one for you. How can the vaccine be safe? How can we be sure it's safe without understanding long-term side effects?
So that is a good question. We don't know the long-term side effects because it hasn't been around for a long time. But what we do know is that it's been evaluated at least for the past 7 months, and that we have not seen any significant side effects in that period of time. That being said, we are in a pandemic where we're losing like close to 25,000 lives every month. If we can use this tool as one of the things in our toolbox to help save people, they really anticipate that we have the ability to save close to 55,000 lives in the next 6 months, which is a huge number. Right now, it looks like we're probably going to lose another 170 to 200,000 people to this disease. And if we can do something to protect them, I think it's very important. I think the possibility of a side effect, a long-term side effect, is real, although looking at the science, I believe it's very small.
Hmm. This is quite a challenging time that we are living in. 2020 has been quite a year. And it's been compounded, the virus is the ultimate compounding of a political climate that has just been incredible. And that just makes the pain and the impact and effects of the virus that much worse. Because once you deal with the virus and you go through that, and then when you get well, the political climate is still out there causing you headaches and stomach aches and foot aches and so forth and so on. But let me come off my soapbox. Let's see if we can get the next question for Dr. Stacy Murray, who is the medical director of Overlook Medical Center at the Union campus. Brother Fuller, another question for Dr. Murray?
Yes, Doc, another question for you. If a child under 18 years old should not take the vaccine, is the family unprotected because the child can catch the virus?
If the family members receive the vaccine, they will be protected, even if the child gets the virus, because they are protected. They have immunity having received the vaccine. When we do know that in general, children have fewer side effects or fewer effects from the coronavirus. They're typically not as sick as adults are. So if the adults in the household receive the vaccine, then they should not get the infection if the child does.
And when you say children and a child, they are less impacted by the virus in terms of infections and hospitalizations. I get that correct?
Yes.
And when you say children and or a child, 18 years of age and younger, you're not talking about an adult who is 40 who is acting like a child 18 years and younger. You're talking about the actual age, correct?
Correct.
All right, I just want to be clear. Just because you act like a child does not mean you fit the category of being less impacted by this disease, because it can be and has been for many quite devastating. COVID-19 is what we're talking about. Surviving it, getting through it, and thriving after it is what we're talking about. Our guest is Dr. Stacy Murray, the medical director of the Union campus of the Overlook Medical Center. And we have gone through signs and symptoms and testing and when and where and how and if and the loss of smell and taste. And we've been in the last few minutes talking about vaccinations, to be or not to be, vaccinations, to get or not to get, and who will be most impacted by them. And we've been blessed by the conversation so far. So we have a few more minutes, and if you have a question that you would like to get responded to, you have just a few more minutes to get into the chat and surface your question. After that, you're going to have to go someplace else and pay for the information that we're giving to you for free this evening. So, Brother Fuller, do we have another question for Dr. Murray?
Yes, Doc. This question says, Pfizer vaccine mentioned that people with allergic reactions should be careful. Is there a way to pre-medicate before the vaccine to mitigate the risk?
So I'm not sure about that. I do think that those who are highly allergic, not someone who may just have a mild allergy to one item is at risk. I think there are a group of people who are highly allergic to multiple things: cats, dogs, a number of foods, a number of medications. Those people, I believe the advice is going to be not to vaccinate at this time. There has not been, according to Pfizer, from what I've read and heard, and I listened today to the Pfizer representatives speaking about the vaccine. They do not feel as if those allergic reactions were severe, meaning they didn't require hospitalization. And so they were able to be treated as an outpatient. So I think that those who are highly allergic may want to consider waiting, but those who have mild allergies, I think, are going to be fine for the virus, for the vaccine.
So, Dr. Mary, we're approaching the end of the hour. And I wanted to give you some time to, say whatever you would like to say, whatever's on your heart, because you're what we call a first presenter. You're on the front line. You're on the cutting edge. You're in this thing, in this crucible every day, and dealing with it. So from your perspective, can you maybe take a few minutes to talk about COVID-19 just from a 30,000 foot view, and then bring it down to earth with any last minute and last important advice that you would pass on to any of us who are listening to this conversation?
Yeah. Like I said, I understand that this is, a very personal decision, and it's something that I struggle with as well as others. I have some of the same questions and concerns that everyone else does. Like, well, what's going to be the long-term effect? Is there going to be any side effects or unintended consequences that we're not aware of that is going to happen that's going to put me or my family at risk later? We all, I think, struggle with those same questions. But like I said earlier, I do believe that what I know about the vaccine is that this vaccine destroys lives. It takes people away from us way too early. And when I look at that and I compare that to the possibility of the unknown, meaning it may be possible that I may get a side effect that may be severe, it's a risk that I'm willing to take if it helps the population at large. I live with my mom. She's 85 years old, and the thought of possibly getting this infection and bringing it home to her and having her have a bad outcome really weighs very heavily on me. And so anything that I can do to protect her and my family as a whole, I will do. And I often say to people, if you're driving in a car and you get in and you put on your seatbelt and you make sure that everything is in place before you start moving, and you use all of the tools that you have available. You don't say, well, if I get in an accident, I don't have to have on my seatbelt because I have airbags and a brake. Or you don't say, if I see a car stopped in front of me, I don't have to use the brake because I've got a seatbelt and an airbag that's going to protect me. You use everything that you have available to you to help you, to protect you. And I think this is just one more thing that we have available to protect us and help us. Because right now, there is no cure. There's only prevention right now. So anything that we can do to prevent this from spreading is what we need to help our community and really help the country and the world at large. because it is prevention. There's no medication that's going to take this away. The best thing we can do right now is prevent ourselves from getting it. And we need to use everything within our reach. That means the mask, that means the vaccine, that means staying away from people, that means washing your hands, using all of those tools in the toolbox to help everyone, yourself and everyone around you. So if you decide the vaccine is not for you and it's not for everyone, that's fine. But if you decide that, then you absolutely should not gather in large groups. You should wear your mask at all times. You should wash your hands frequently. You should use everything in your toolbox to protect you. And that's really what I feel.
So a last word of emphasis and maybe repetition for the young people, those who may not be 18 and under, but those who are like between 19 and 30, between 19 and 35, between 19 and 40, who just have to go out, who just have to party, who just have to go somewhere, who just have to travel, who just have to move, who just have to have a drink, who just have to go out to dinner, who just have to meet and who just have to socialize. A last word of advice or emphasis or repetition for them.
Well, that generation loves anything technologically advanced. So do it by Zoom. If you have to do it electronically. You guys, can definitely meet up and party and do all of these things without being face to face. So that would be my advice. You can buy everything in the mall, everything in a store that you need, you can buy it online. If you need to see someone, you can FaceTime them. You can Zoom with them. You don't have to be face to face.
Thank you so much. Thank you so much. This is Dr. Stacy Murray. Again, the medical director of the Union Campus of the Overlook Medical Center. She has been gracious enough this evening to be our guest. Our subject has been COVID-19, its symptoms, its implications, its ramifications, the vaccinations, the testing. We've tried to cover as comprehensively as possible and give as much advice as possible that will serve to save us from the ravages of this pandemic. I want to thank you, Dr. Murray, for taking your time to be with us on this evening. Thank you, thank you, thank you.
Thank you for having me.
Good. We'll look forward to another occasion. And so let me ask those of you who are listening and viewing to pay attention to the announcements that will scroll at the end of this broadcast. And as always, we thank you so much for your continued contributions to the sustenance of this ministry. For without your generous gifts, the ministry is not possible. And we pray that you will continue to be safe, be healthy, and be blessed. God bless you. We'll see you Sunday morning at 9:30 a.m.